place a person at risk for gastrointestinal disease. A stress B. Smoking. C. High fiber diet. D. Salicylate ingestion. Ans. C. 2. The portal vein transports venous blood from the gastrointestinal tract directly to the A. liver, B. colon, C. spleen, D. gallbladder. Ans. A. 3. Peristalsis is defined as the churning of food, B. rhythmic contraction, C. turbulent blood flow, D. passive regurgitation. Ans. B. 4. The blank controls the amount of food that moves back up the esophagus. A. duodenum. B. cardiac sphincter. C. gastric mucosa. D. pyloric sphincter. Ans. B. 5. Drinking alcohol with a fatty meal, A. delays gastric emptying, B. slows duodenal absorption, C. increases gastric absorption, D. rapidly increases blood alcohol levels. Ans. A. 6. The pancreas, liver, and gallbladder connect to the digestive system at the A. ileum, B. cecum, C. jejunum, D. duodenum. Ans. D. 7. Bile is stored in the blank and is released into the blank, where it helps to blank. A. liver, gallbladder, break down fats. B. duodenum, gallbladder, digest food. C. gallbladder, duodenum, emulsify fats. D. liver, gallbladder, metabolize proteins. Ans. C. 8. The conversion of glycogen to glucose occurs in the A. blood, B. liver, C. spleen, D. pancreas. Ans. B. 9. Which of the following is not a function of the liver? A. storage of bile. B. drug detoxification. C. storage of vitamins and minerals. D. completion of red and white blood cell breakdown. Ans. A. 10. Most of the digestive process occurs in the A. liver, B. pancreas, C. jejunum, D. small intestine. Ans. D. 11. If water is not reabsorbed in the colon, a diarrhea occurs. B. constipation occurs. C. the appendix may rupture. D. waste material is solidified. Ans. A. 12. The exocrine function of the pancreas produces A. insulin, B. glucagon, C. enzymes, D. somatostatin. Ans. C. 13. Filtering of blood and recycling of dead red blood cells are functions of the A. liver, B. spleen, C. pancreas, D. kidneys. Ans. B. 14. Pain over the suprapubic region is most suggestive of injury to the A. urethra, B. ureters, C. bladder, D. iliac arteries. Ans. C. 16. Patients with an extremely advanced bowel obstruction may have feculent breath, which is the odor of blood, B. chyme, C. acetone, D. stool. Ans. D. 19. Common signs and symptoms of acute gastroenteritis include all of the following: except, a fever, b. chest pain, c. severe diarrhea, d. abdominal pain. Ans. A. 20. Which of the following conditions would be the least likely to result in peritonitis? A. stomach rupture, b. splenic laceration, c. acute appendicitis, d. bowel perforation. Ans. B. 21. In contrast to a patient with peritonitis, a patient with hepatitis would most likely initially experience a hematochezia, b. diffuse abdominal pain, c. right upper quadrant pain, d. referred pain to the left shoulder. Ans. C. 22. Dunphy sign is observed when a right upper quadrant pain is referred to the right shoulder. B. Coughing causes severe right lower quadrant pain. C. The patient's abdominal pain radiates to the shoulder. D. Pressure on the abdominal wall is suddenly released. Ans. B. 23. Esophageal varices are a direct result of esophageal erosion, b. alcohol consumption, c. portal hypertension, d. cirrhosis of the liver. Ans. C. 24. Chronic use of nonsteroidal anti-inflammatory drugs would most likely result in a diverticulitis, b. esophageal varices, c. acute gastroenteritis, d. peptic ulcer disease. Ans. D. 25. Common signs of bleeding in the upper gastrointestinal tract include all of the following: except, a melena, b. hematochezia, c. hemoptysis, d. dark, tarry stools. Ans. B. 26. An obese 52-year-old woman who presents with severe pain in the right upper quadrant of her abdomen and pain in her right shoulder is most likely experiencing a cholecystitis, b. acute hepatitis, c. Crohn's disease, d. Mallory-Weiss syndrome. Ans. A. 27. The most likely cause of Crohn's disease is a. autoantibody destruction of the intestinal wall, b. precancerous lesions in the lower intestinal tract, c. chronically high triglyceride levels in the blood, d. infection of the gastrointestinal tract with Helicobacter pylori. Ans. A. D. 29. Pyloric stenosis is the most common cause of a. Mallory-Weiss syndrome, b. infantile intestinal obstruction, c. gastrointestinal bleeding in adults, d. mesenteric ischemia. Ans. B. 30. Intestinal adhesions would most likely result in a. diarrhea, b. gastroenteritis, c. bowel obstruction, d. ulcerative colitis. Ans. C. 31. An incarcerated hernia is one that a. causes immediate bowel necrosis, b. cannot be reduced and becomes trapped, c. spontaneously returns to its normal location, d. protrudes through an incision from a recent surgery. Ans. B. 32. A patient with an advanced bowel obstruction would most likely present with a. feculent breath odor, b. black, tarry stools, c. bright red hemoptysis, d. deep, rapid respirations. Ans. A. 33. Which of the following assessment findings or techniques would prove MOST useful when determining the extent of internal volume loss? A resting blood pressure. B. Temperature of the skin. C. Duration of the illness. D. Orthostatic vital signs. Ans. D. 34. A patient with orthostatic vital sign changes often requires atropine. B. Is severely hypotensive. C. May faint upon standing. D. Has intra-abdominal bleeding. Ans. C. Ans. C. 36. A protuberant abdomen. Would MOST likely be encountered in a patient with an abdominal evisceration? B. Peritoneal fluid accumulation. C. Decreased abdominal volume. D. An acutely inflamed appendix. Ans. B. 37. When auscultating bowel sounds, borborygmy is characterized by absent sounds after 2 minutes of auscultation. B. Quiet sounds, occurring at less than 1/sec. C. Soft gurgles or clicks occurring at 5 to 30 per minute. D. Loud gurgles occurring greater than 30/min. Ans. D. 38. If a patient complains of left lower quadrant abdominal pain, you should first palpate the A. Right upper quadrant. B. Right lower quadrant. C. Left lower quadrant. D. Left upper quadrant. Ans. A. 39. Hepatic encephalopathy is a condition in which a liver disease causes reduced brain function. B. The liver is acutely inflamed from a virus. C. Acute hypoglycemia results from liver failure. D. Alcohol progressively destroys the liver tissue. Ans. A. 40. In contrast to somatic pain, visceral pain, A. is well localized. B. Indicates peritonitis. C. is difficult to localize. D. increases with movement. Ans. C. 41. Irritation or injury to abdominal tissue, causing activation of peripheral nerve tracts, would MOST likely result in blank pain? A. Visceral. B. Somatic. C. Rebound. D. Parietal. Ans. B. D. B. 44. Blood that has been digested by stomach acids manifests as A. Hematochezia. B. Bright red vomitus. C. Gray-colored stool. D. Coffee ground emesis. Ans. D. 45. A sudden onset of discomfort in the throat, severe dysphagia, and vomiting bright red blood are MOST indicative of A. Ruptured esophageal varices. B. Gastroesophageal reflux disease. C. A malignancy in the esophagus. D. Hemorrhage from a peptic ulcer. Ans. A. C. 47. Icteric sclera and colic stools are clinical manifestations of A. colitis. B. cirrhosis. C. pancreatitis. D. diverticulitis. Ans. B. D. B. D. A.